The miracle worker bit did surprise me, but I know exactly who that is, and he's a wonderful young man, and yes, having dyslexia is something near and dear to my heart, and it's not today's topic, sadly, but it is a topic I've been speaking about around Australia with Generation Next conferences over the last 12 months. Because, of course, when you don't have that currency to access print in a school environment where that is the very currency that you need, it's a pretty hard ask. It's pretty hard to keep your confidence and a belief in yourself. So thanks, Helen. Where do we start? Well, you know that I'm not an orthodontist. You know that I'm not a medico. So from that point of view, you'll just have to be patient with me. But maybe it's an advantage, given the work that I do and the tricky young people that I work with and the families that I work with. And maybe I can play with some possibilities of how to increase your patients' motivations with fresh eyes. Earlier this morning, I raised the idea that it's pretty unwise to set out to control someone to make them do what you want them to do, no matter how clever we think we are or might be. The truth is, we can't really control anybody. Can't control our patients, can't control our staff, can't control our partners, can't control our kids at home, but we can control our style, how we actually manage things. Got to figure this one out. Yep, I've got it. So to do this morning, we worked our way through the social control window. And those of you who were with me this morning, you can take a deep sigh of relief. We're not doing that this time. But the social control window highlights that when we're able to work with others rather than doing it to them or not to them or having power over them, and when we work in the yellow authoritative quadrant, we offer them and ourselves the best chance to thrive. To be honest, I'm surprised that you needed anyone within or outside of your profession to discuss the aspect of patient motivation. You see, when I started a little lightweight research, I discovered thousands of images on Google about orthodontics and dentistry. And I've brought a few along just to tune you in. Look at her. She's so happy. She has a beautiful smile and her teeth are so white and her life has come together. And she is so grateful. You can see, look at the glint in her eye and look at the smile. Look what's happened here. I think they've both gone to the orthodontist. Her life's changed. She's now hooked up with a partner. He's thinking school's different now. My friends are seeing me differently. She doesn't care that you can see her teeth because they're already moving. They look wonderful. And you learn new things. You know, as long as you can persevere. Oh, and look at these siblings. They're now really happy together instead of fighting in the backyard or over toys all of the time. It's just, for me, it's fantastic. There's a suggestion when I looked at Google that your profession actually brings great satisfaction to people, perfection to people, lifelong happiness, beauty, gracefulness, a new image and possibly a new life. Perhaps this poem is closer to the reality. It's called Braces. I just came from the orthodontist and let me tell you this, he put braces on my teeth and now I can no longer kiss. I don't know why I was excited, I don't know why they'd kill my teeth. I don't know why they kill. My teeth are throbbing in pain. I think I need an Advil. They say I can't chew gum. And why are there so many rules? No hard lollies, pretzels, bagels. I think they're all just fools. I can't wait till my next visit. They'll make my braces tight. Why are my teeth so bad, especially that overbite? That's the whole reason I got braces. I hope to get them off soon, because if I don't this year, it'll be 5 years in June. So my research continued, and I discovered what I think most of you would know. The better a child, a teen, or an adult cooperates with you, the better the results. Yet every one of you has struggled at one time or another with a difficult or unmotivated or uncooperative patient. I also discovered that parents often have a far greater motivation for their children to have orthodontic treatment than the kids themselves have. And it's common to see their parents' motivation not rubbing off on the kids. How ungrateful are kids today? This treatment isn't cheap. How do we put kids in the driver's seat? And in essence, that's my aim today. When it comes to getting the best from patients, there is a secret ingredient, and it's all about relationships. According to John Hattie's meta-research, the perseverance, motivation and achievement of students in schools is dramatically influenced by the quality of relationship they have with their teachers. Now, I better give you some background. John Hattie, he's a professor in education from New Zealand. He is considered educational royalty. I worked with him for a couple of years and did some touring with him. He would have ministers of education lining up on the tarmac as he got off planes. He would have the red carpet rolled out, and I walked just behind him. And little did I know that that red carpet would roll up just in front of me, and I never quite got to stand on it. Very highly regarded work. His findings are completely data-driven. There is no subjectivity. He crunched data from 500 meta-studies, which accounts for 83 million students in schools over 36 countries. He wanted to discover what works in schools to support student outcomes. He was tired of the subjective war stories offered by teachers. So he tested 138 popular educational ideas, and guess what? Relationships. Relationships count. They are, in fact, in a very, very small handful of powerful things that really do matter. Hattie's work offers a very powerful insight into the work that you do. He says nothing is as effective as real, honest, natural, everyday engagement. He says adults who know themselves and in their own way are prepared to smile, wink, pull a silly face, give a nudge, a dare, a joke, do a zombie walk, a friendly eye roll, a thumbs up, juggle balls, swallow swords, or give a kind or reassuring comment, encourage humanity between people. And you know what? It's not rocket science, really. But sometimes the pressure of running a business and the pressure of getting people in and out of a room can get in the way of building relationships, especially with our trickier younger people, where it takes longer and it actually takes more input. We can also appreciate in really quiet, reflective moments such as today that harshness, a professional briskness, or too much criticism contributes towards disengagement. So, can I ask you a very personal question? Do not call out the answer. Do you like kids? Do you like teenagers? See, the truth is that there are a lot of people called parents that have them. They love them, they suffer through them as they grow through that awkward stage. But most would never choose to work with them. Most gladly go to work every day just to find a little respite for a few hours. Now, if you don't really like them, but you love orthodontics, you do have a bit of a problem. Most kids and most teens will pick up if you don't like them. They've got precision-built bullshit meters. And just as we do with one another, kids and teens will quickly gauge, they will quickly assess your character. They're really astute. They read our intentions and our authenticity in a heartbeat. Very quickly, kids and teens decide how to respond to you. Based on the connection or the lack of it, they'll write a script in their head, and it's one that they'll follow. If you're mean to me, I'll be surly back to you. If you treat me well, I might give some of that back to you, but not in the same amount that you give to me. Without relationship, you're bound to overlook giving this young patient some influence over their treatment, even though you know, and I know from the research that I read, that their motivation is often a result of the level of participation you give them in their treatment. So I've got a 2-minute task for you. What I need you to do is just grab a bit of paper and a pen. I want you to turn to the person next to you. Now, if you've got a person on the end who's at the aisle, you might have to make a threesome, because I'm just not going to put up with people being isolated. That is so not nice. But here's what I want you to do. In 2s or 3s, I want you to spend about a minute, and I want you to turn to the person and record as many insignificant things you can do with your young patients so they feel they've got some choice and control over their treatment. Go. Keep going. This is a competition. Okay, I might stop you there. Who managed to come up with 3 things or more? Yeah, great. Those without their hands up, not so good this time, but you'll do better next time. Who managed to come up with 5 or more things? Whoa. Who went above 10? Anybody get to 10? We got it? Yeah, we did. Okay, excellent. Okay, now let's do a replay. Same again, but now I want you with these same people or this same person to start to record as many significant things you can do with your young patients so they feel like they've got choices over their treatment. Go. And I will stop you, but again, my purpose here is simply this. There are so many insignificant and significant things that I don't know what you really can do because it's not my profession, but I'll guarantee you've teased out a whole bunch of ideas together. Wouldn't it be good if we could actually input those ideas to a collective centre for everybody to have a look at? Because sometimes we really need an injection of ideas outside of our mind and from other people to help us along the way. Finally, I've got a tip for those of you who are struggling to like a particular child or teen patient. Here it is. Next time they're with you, stop working. Don't hide behind your work. Just stop working. Slide your chair around and engage with them. That's right. In the back of your brain, you can count to 60 seconds. It's all you have to do it for. Look into their eyes and ask a question or two. Or ask them for some advice about something that you know they know about. And as you do this, search for something you can find to like about them or something that you can begin to build relationship around. Start faking your relationship with them, even if it's just to get an initial footing. And eventually, your interaction will become genuine. What about adolescents? Well, there's some things we need to know about adolescents, and I wish I had a lot longer instead of one slide. But here we go. This is what you've got to wrap your head around with teenagers. They're fun-loving, they're moody, they're unpredictable, they're loyal. If they love you, they love you. They're surly, they're secretive and insightful, and can be obstinate and incredibly selfish, all in the space of a few moments. There's just no predicting them. What did Mark Twain say? Classic Mark Twain. You ready? When a child turns 12, he should be kept in a barrel and fed through the bunghole until he reaches 16, at which time you plug the bunghole. We now know the teenage brain is far, far from complete, especially the frontal lobe, and especially in, you got it, especially in boys. The average boy brain doesn't have a fully developed frontal lobe, you know, the one that actually provides delayed gratification, until they're about 30 years of age. That's a neuro fact. I know there are some of you here in your 40s, 50s and 60s and your partner still believes that your frontal lobe isn't working. Sadly for you, the adolescent brain is only about 75% developed. It functions really differently from an adult's brain, despite the fact that teenagers today have bodies that look like men and women. It is so deceptive. Don't get caught. There are areas, particularly those areas dealing with motor control, hand-eye coordination, gee, they're great on Xbox, that are really well honed, as they ever will be. But there is so much about their brain that is still in construction. It helps to be mindful of this because teens can easily be victims of their youth. Here's a relationship building exercise you can take back to your team at work. And it's a really good way to get everybody on the same page. It's something that I do in the area of education with teams of teachers. But I think in this situation, it's perfectly applicable. So this is a perfect way for everybody to start a dialogue around what works, what provides quality. So you divide a whiteboard or a large sheet of butcher's paper in half. You put, what do we do or say that builds positive relationships with child and parent patients on the left-hand side? That's your positive side. And then you put at the top, this is on the right-hand side, what do we do or say to a child and parent patients that has the potential to damage relationships? This is the negative side. Spend 10 or 15 minutes with your team just being really candid and brainstorm. No holds barred. Just go for it. Next, rate the most harmful behaviours from the negative list. Rate them from 1 to whatever, so that you understand that number 1 is the most alienating behaviour that can happen in our practice. Finally, go to the positive side and choose your top 5 and turn them into practice goals. Once again, the aim is to get everyone talking, as healthy discussions are pivotal to positive changes. This exercise frames the importance of relationship and improving engagement. Look, an obvious word to the wise. The fear of the unknown, fear of sharp objects and of sharp objects in the mouth that might cause pain are really common fears, even though you know what you're doing. Set your patient free of this worry as soon as you can. Encourage them to tell you what they're worried about, even if it sounds crazy. Crazy's good. Together, work a plan so they feel more confident, more in control in the chair, and they won't need to worry. Explain the treatment process to patients before their first visit. This could be in the form of a friendly letter, a brochure, and/or a survey that sets out treatment facts in your practice, not a generic. Dispel the myths as early as possible, because you know there are boundless myths in the community about going through orthodontics. The bonus is you also diffuse parental anxiety as well. Oh yeah, you know this. Kids are really perceptive. They know if mum and dad think the appointment's going to be something to fear, they're likely to be afraid and climbing the wall too. So this is the time to survey the parent and ask, how's your child feeling about the treatment? What do they want from the treatment? Do they know why they're having treatment? Do they know what the treatment's about and what the end result is likely to yield? Do they have a realistic view of treatment? What is it? Are they keen about treatment or are they anxious? Do they need an orientation visit before we start treatment? Do they need a series of orientation visits before we start treatment? What do you think will help? And so on, and so on, and so on. Parents have a wealth of knowledge about their kids, and it's to your advantage to tap right into it. So set up mechanisms that allow you to do this. This kind of information also sets you up for the best possible first interaction. And do remember, your first interaction is the one that becomes imprinted on their emotional memory about you. So set it up so it works well. For some, go slow. For some, you'll need to go really slow. A few will need to come along for multiple visits, simply to talk with you, to talk to the staff, explore the place, check out the smell. I'm thinking of my clients, of course, who are on the autism spectrum. These are big issues. These are sensory issues, and kids can become overwhelmed really quickly. Let them check out your instruments, sit on the chair, finally lie in it. It will take a lot of time. What did one of my friends say? Well, Mark, in the animal world, you have to be really brave, don't you, to lie on your back with your tummy up when you're feeling so vulnerable. I think it's the same for human beings. We're actually asking them to be incredibly vulnerable or be in a vulnerable position. For a few of the kids with high-level anxiety, for these few, just a gentle clean after a series of visits would be a massive breakthrough prior to their first real appointment. It's about building confidence and it's about building trust. And for those with extreme fears, consider working in combination with a good psychologist or a counsellor. Phobias can be treated using techniques such as desensitisation therapy, which is very effective. As you work with your patient, gently inform them what you're doing, just step by step. To be relaxed and cooperative and free of anxiety, kids need to know what's happening. Encourage them to use hand signals if they feel uncomfortable, need a break, or must ask a question, even though it drives you to distraction. Even though it might be inconvenient as well. Secondly, consider forms of sedation or anti-anxiety medicine for extremely nervous patients. Many of your anxious kids are probably already taking medication. Teach your patients how to relax. Teach them how to do diaphragmatic breathing and progressive muscle relaxation while they're laying in the chair. These exercises are so easy to find on the net and can be printed for parents to teach kids, or you can teach kids as you work away to do them. In addition, play recordings that will take patients through a breathing or muscle relaxation exercise. Alternatively, listening to music can be helpful. Most of your clients have their own iPods, so encourage them to bring them along. And there's no reason why you can't have an iPod in your rooms loaded with stories, different styles of music, relaxation exercises for patients to use. Plugging patients into the television mounted above them can provide a beautiful distraction for some. I'd suggest you use a video that won't send you mad. Alternatively, make sure kids use earpieces so you don't have to suffer through it over and over again. Another idea is to make a sensory toolkit. At each visit, invite your anxious patient to choose something from the toolkit and fiddle with it during treatment. Ideal sensory fiddle items include little stress balls, bigger stress balls, soft play putty, play gel, Velcro strips, a range of animal-shaped toys made of soft gel-like material. If you want to explore more about a sensory toolkit, you can go online and just type in sensory toolkits. But you know what? Ask your local school teacher or ring your local school. They'll give you some wonderful advice in this area. How much longer? You've probably heard that question a million times before. Well, one way to show how much longer is to bring out your colourful goo timers that actually run goo from one section to another. Kids know that after this goo timer's emptied, 6 minutes will have gone, or 11 minutes will have gone, and they can actually watch the goo run, and it gives them a good visual representation of time moving. Oh, and remember and tell me early in the treatment for anxious kids. To do this, have your patients learn the name of each instrument and what it does. Some of our anxious kids love this game. As you go to use it, hold it up, see if they can remember. Add up how many you can remember. Keep a tally from one visit to the next. Make it fun, make it rewarding, make it a distraction. In addition, let them hold a mirror. Let them actually see what you're doing. I'll never forget that one of the most effective techniques for calming and encouraging kids is just genuine praise. Every kid does something right during the course of a visit. Be relational, be flexible. Allow siblings to stay together if you think it works for your patient. Younger children usually do better with parents present. Most parents are helpful. However, for some teens, as I mentioned this morning, it's better not to have the parent present. Make the judgment early. Is it detrimental to your relationship with the patient if you're constantly involved in a war they bring into your room and, in fact, everywhere they go together? A few years ago, I started a mentoring plan for Catholic education in Australia, and it's now in hundreds of schools throughout Australia. And I thought I'd throw this one in today because I wanted you to have a quick look at a clause that we build into it. So the mentoring plan works like this. We put together a teacher or a staff member at a school to meet with a vulnerable student once a week for 20 minutes to 40 minutes each week. And they work on plans to strengthen the students' functioning at school. So it can be academics right through to socialisation, right through to behaviour plans. But one of the things that we set up is at the bottom of the screen. It's a no-blame clause, just in case things go wrong. So firstly, made me wonder about treatment plans, which I know very little about. But I wondered whether your treatment plans carry a similar theme. Firstly, is your treatment plan easy to read? And is it written in a patient-friendly way? Do you have before and after visuals on the treatment plan so that kids get a really good understanding what their teeth are like to start with and what they should look like by the time you've finished your magic? This is highly motivating stuff. Do you state that you'll remove the braces if, in your opinion, the patient isn't yet ready to care for the appliance and the teeth? In other words, do you embed a treatment release clause in the plan? Do you have the parent and patient signed off at the start? Do you provide a copy of the treatment plan to the parent and the patient? I suspect your biggest worries usually relate to awful oral hygiene, constant breakages, or where the patient is at risk to damage their teeth. And I'll bet some of you have some gobsmacking stories. As you get that sinking feeling that treatment's heading the wrong way, pull out your copy of the treatment release document, because on there, in very easy language, you've already itemised a tick box system of what would prompt this. Have 3 sets of tick boxes, and when they're all ticked, it's time to withdraw. Chat warmly and seriously with your patient and tick the appropriate boxes on the document as you go. Let them know that if it's the same next time, then treatment should stop. Maybe a good idea to follow up with a beautifully warm, encouraging letter to your patient and one to the parent as well. While this letter is encouraging, it also needs to clearly restate that unless the care improves, you would need to remove the appliance. Let them and their parents know that you would be willing to try again later on. Refrain from using words such as failed, or a warning letter of appliance removal, or a warning letter of uncooperative orthodontic patient, or calling them a non-compliant patient or uncooperative. Keep the language to what it is without labelling, because mostly these patients are victims of their youth. They are simply not ready to care for their teeth or the appliance. As best you can, assign no blame. Your patient was not ready for the understanding and care required for the level of this kind of treatment. And what about feedback? Feedback's really important. A proven strategy to increase children's level of motivation during treatment is to regularly talk about the progress being made. As obvious as it sounds, this thing called feedback sets up these really natural opportunities to involve patients in treatment decisions, significant and insignificant, developing the skills to take greater control over their own oral care at home with less input from their parents. That's right, putting them in the driver's seat, to celebrate positive treatment changes. What do you do to celebrate milestones? Have you got a particular thing that you've built in? It's also an opportune time to raise discomfort or pain levels your young patient might be experiencing. That's right. When you get in first, it can be a factor to enhance their motivation. This is so much better than your patient hearing, look, don't worry, there's always a bit of discomfort with this kind of treatment. Kids and teens know when they've been blown off. They'll resent you for it. You'll impede their motivation because discomfort suddenly becomes their problem, not a shared problem that you're happy to participate in. And remember, effective feedback is a process. Oh, and finally, there's another significant thread to feedback, and the significant thread is we need to receive it as well. This is the feedback we need back from our clients or patients to find out about our performance. This information about our performance is powerful stuff, and it helps us develop our best practice. So think of ways to collect that data. Helen, how long have I got left? 5. I want to talk a little bit about token systems today. Token systems or reinforcement systems. There are two chapters in my book, Raising Butte Kids. They're creative ways to keep young people heading in the direction that you want them to go. So a token system is a lovely visual way of recording positive steps along the way. It highlights what's valued around the treatment. It's a system that allows us to develop desirable behaviours by charting success. Think of it as a way to help a young human being stay excited about a goal that's taking so long and I don't have an oversupply of delayed gratification. At home, token systems help family life run so much smoothly too, because they take kids and the adults out of a negative cycle. Now, I'll give you an idea of a couple of token systems that might be useful. Just yes jars. We use yes jars for kids at home. That every time mum or dad in a certain period says, hey Mark, can you do such and such, or could you get ready for bed, or could you clean your teeth? And little Mark goes, yep, I will. Something goes in his yes jar. You can adapt that in terms of a treatment plan and cooperation and give feedback. We also use raffle tickets, and you get kids to collect raffle tickets. You could organise a whole range of little things that kids could collect, and when they reach a certain point, they actually are rewarded as an incentive. Star charts are classic. We see parents and I see some professionals using cut-ups. For example, one of the girls that I work with sees an orthodontist who's into music, the same as she is, and she's decided to add to her CD collection, and they decide on what CD is going to be supplied. She brings along, the orthodontist buys the CD. Mum and Dad refuse to buy the CD. That's the one that she's aiming at. They photocopy the cover. They cut the photocopy up into about 15 pieces, 5 pieces. When the 5 pieces come back over treatment, that's theirs to keep then, not the pieces, but the CD. You can use iReward Chart. It's an iPhone app for each of the patients that you see. And it's a way of actually collecting data and letting the kids see that the data goes in. And that way, kids can actually receive payoffs if you want to organise it that way. And there's an app for iPad called ChawPad, which you can use in a similar way. So you can get right into technology. And loyalty cards are a really good way to go too, where you just simply click your loyalty card. You can get them made up in plastic. They're good fun. I've got to finish. So my quick finish goes like this, okay? What else is going to prevent the motivation and compliance of your patients? The short answer is us or you. You work really hard. Your work is often really relentless. You've got to take care of yourself. You've got to make sure that you keep yourself in the best possible space that you can keep yourself in. Because if we don't have this objective view, we often can't see ourselves as part of the problem and part of the solution, and we're really quick to blame other people. So I would ask you, what do you do to look after yourself? What do you do on a day-to-day level, week-to-week level, month-to-month level to make sure your spirit is being nurtured? Really important that you've got, as a professional in a giving profession, that you've got a really good mental health care plan for yourselves. Some ideas. Make regular time for fun, family, friends. Join a choir if you've always wanted to sing. Start singing. A hiking group, art classes. Just listen to your music. Join a movie club. Join a book club. Start model building. Do anything that you know gives back to you. Take the dog for a walk. Go to the gym religiously or regularly. But do something that you know you're getting something back from. So do me a favour, make sure you've got a great mental health plan working. And my last slide, I think. I wanted to play with a vital aspect of our work with children, but it was all around our mindfulness. In truth, the ideas that I've presented in both presentations today are healthy, common sense approaches that really have been around for decades. They work, but sometimes ever so gradually. I work with a lot of kids who've been traumatised. The work is a 25-year plan, if we're lucky. What is it about working with difficult kids? They challenge us to think about what we do, why we do it, and how we do it. And the little devils, they prevent us from becoming complacent. They dare us to engage with them when they're the sort of beings that you initially think, I don't want to engage with. They dare us to be constructive and optimistic even when we're under fire. They teach us about the depth or shallowness of our personal resources, and they teach us about the real depth of human spirit. Thank you very much.